Hi, good morning. Welcome to the webinar. Our topic today is personal care with positivity, assisting persons with dementia in their ADLs or activities of daily living. We are very excited to get underway today, and we have a fabulous presenter, our own Dr. Melissa Klabe. This webinar is brought to you by our collaboration, our consortium of sponsors, including Care Choices, Hospice and Palliative Services, O'Connor Mortuary, Caring Companions at Home, and of course, Alzheimer's Orange County. And I am Kim Bailey, a program and education specialist with Alzheimer's Orange County, and I'm delighted to be your host today. Our sponsors, as you know, are providing this as a public service to the community. We present topics that we feel are beneficial for anyone who cares for and works with older adults. And so we hope that you will be as excited about today's presentation as we are. I think it's going to be very informative and useful for all of us. As mentioned, our presenter is going to be Dr. Melissa Klabe, and she is the Director of Education for Alzheimer's Orange County. She's a licensed physical therapist and holds a doctorate in physical therapy from Cal State Long Beach, as well as a bachelor's in communication studies from UC Santa Barbara. Prior to her role at Alzheimer's Orange County, she worked as a clinical consultant in the medical device industry and as a research physical therapist for the Long Beach VA with veterans with spinal cord injuries. In addition to her professional clinical experience, Dr. Klabe has 10 years of personal experience as a caregiver for a loved one with Alzheimer's disease. And it's with great pleasure that I turn the presentation over to you, Melissa. Thank you.
Thank you, Kim. It's so nice to be back with you again. Here we are, another webinar. So I'm going to jump right in. I'm going to try not to talk too fast. We've got a lot to get through today, but it's all good stuff, so bear with me. Our objectives for today, really the focus for today is the title, Personal Care with Positivity. I want you to feel this theme run strongly through today's discussion. Of course, I want you to walk away with practical strategies. I want everyone to walk away with something new today, a new strategy, a new skill that you can use in your daily work with persons with dementia or other cognitive impairments as they go through the stages of their disease process. So let's begin our time today talking about some of the typical changes in function we may see with normal aging versus some changes that may be cause for concern or what you would expect with someone with a diagnosis of dementia. So just like a computer that gets older, our speed of processing information is going to see some slight declines. But a decreased ability to learn new information should be a cause for concern, as well as any memory loss that disrupts daily life and is a change from before. Notably, the only domain of cognition we should not see a decline in is language. We should be able to maintain this area and learn new words. So changes in verbal intellect are worrisome and should be evaluated. And finally, our favorite, multitasking or dual tasking. This is going to become more difficult as we age. We become more easily distracted. But trouble with very familiar tasks, such as the activities of daily living that we'll be discussing today, is worrisome. And again, it's to be expected if somebody has a diagnosis of Alzheimer's or another type of dementia. But if somebody has not been diagnosed with a cognitive disorder and is experiencing any of these warning signs, it's important to get assessed because there may be many causes and some of which may be treatable. Some of these may include stress or fatigue, medications, low blood sugar, dehydration, normal grief or depression, and a big one is sleep deprivation. So I'm not going to go into tons of detail here, but I want to highlight a few changes we see in a typical progression of Alzheimer's type dementia as it relates to ADLs. So in the mild or early stage, a person may still be doing many of the things they've done their whole life. Hopefully they're still engaging in social activities. But we're likely going to be seeing some or maybe all of the following: confusion with time and place, language difficulties, repetition of stories or questions, and trouble with some executive functioning like planning or organizing, managing money. In the moderate stages, we'll start to see more of the typical changes in abilities to perform these ADLs. Choosing proper clothing for the season, grooming, self-care, these are going to become more challenging. And in some, we may see the beginnings of some episodes of incontinence as well. And then in the later stage, or severe stage, we see individuals likely needing assistance with all ADLs. They may experience some trouble swallowing, some of the other consequences of immobility, such as falls or pressure sores or contractures. And speech and communication is likely going to be very limited at this point. The bottom line here is that as the person progresses through these stages, they're going to need more and more help. So we're going to need to prepare for that. And we want to still allow for as much of their abilities to shine through as possible. So what exactly are ADLs? We're actually talking about two different types here. We have on the one side here instrumental, also called complex ADLs. I actually like that term a little better, and basic ADLs. Complex ADLs are on the left here, and they're not necessary for fundamental functioning, but they allow a person to live independently in a community. So they include things like communication and companionship, and things listed here, transportation, shopping, meal prep, housework. And then we have our basic ADLs, more of the self-care type of tasks, hygiene, dressing, feeding. I think it can be helpful to look at the cognitive load here as they're listed out to think about what a person may need help with as their cognition changes. But of course, it's not always clear cut in this order, right? Bathing, for instance, is a less cognitively demanding task, yet it can commonly be one of the first things to become difficult for many reasons that we'll talk about a little bit later. With dementia, there are a number of barriers to carrying out ADLs. One is the change in the person's ability to actually complete the task, and another is an ability to recognize that the task needs to be done without somebody else prompting them. Study after study shows that higher dependence with ADLs is correlated with expedited institutionalization, increased healthcare costs and risk of mortality, and poorer quality of life. Now, on the other hand, in nursing home residents with dementia, greater independence with ADLs, especially dressing, eating, and toileting, were found to be associated with higher health-related quality of life. Research has suggested that unmet needs may tell us more about the person's prognosis than some of the standard measures that we have. So paying attention to changes in the person's ability to care for themselves may help us predict further cognitive impairment and be an important impetus for us to look at what care plans we have in place. Maybe an increasing dependency might signal a need for a care conversation to take place to clarify the person's desires should they be unable to provide for their basic needs in the near future. Let's take a moment here to reflect on a phrase very commonly used and heard, resistance to care. I've used it myself. Now, these are quotes by a man I really admire. We reference him a lot. His name is Dr. Al Power. He's a geriatrician, an author, a thought leader in dementia care. And he has a strong belief, as do I, that quality dementia care requires a shifting of our perspective. He says, what is commonly seen as confused or challenging behavior is in actuality compensatory or adaptive behavior by an individual who continues to express agency and purpose in their own unique way. Bottom line here, what we often call behavior, often in the form of resistance to care, is and should be seen as communication. In fact, it may be the only way somebody has left to tell us something, and we need to figure out how to listen. When we frame someone's reaction or expression as simply resistance to care, the blame game stops with them, right? They are resisting. It's their problem. We aren't really forced to look beyond at what we as carers may be capable of changing in our approach in the environment. So Dr. Power goes on to say here, our fatal flaw is focus on a person's distress as the problem rather than a symptom of a larger issue. So if we see immediate distress as the sole problem, then eliminating that distress becomes our main goal. We often turn to distraction techniques instead of taking the time to get to the true root of the issue. And so what happens is we see the distress surface again and again and again. Of course, a quick distraction may be necessary as a short-term solution in a pinch, but for lasting change, Dr. Power argues, we need to look at the bigger picture and ask, why is this distress repeatedly occurring? And figure out how we can change our approach or the environment, or likely both, right? Our goal should be to enhance overall well-being whenever possible, and this will in turn reduce distress. And this is so important with things like personal care. It's intimate and it requires trust and comfort and involves really important things that need to get done. But I'll argue it's not always worth doing it in that moment if it leaves a bad taste in someone's mouth, because people with dementia will remember how you and how certain events make them feel. If they're being forced into a bathing situation that is traumatizing, on some level, they will remember that. And neither of you will have a good experience with it going forward. It will always be a battle. Unless we can reframe it and make it enjoyable, which I believe we can. We should strive to include the person with dementia in planning and decision making wherever possible. In order to do this, it's necessary to have as many person-centered details as possible regarding routines and preferences and dislikes. And recording these will be immensely helpful for the present, as well as when the person experiences further declines in ability later on. And so these can be some good questions to ask to start with. What does the person wish to do for themselves for as long as possible? And as they need more help, what kind of help would they prefer? Whom would they prefer to help bathe them? Maybe it's not a family member. Maybe they do prefer outside help. You don't know until you ask, and the ability to ask may only be available for a limited time. So having these conversations early and often can be really, really important. We spend a lot of time in this profession, and even in this discussion I already have, talking about what is lost with dementia. But I think it's really important to talk about what remains, especially when we're talking about assisting with care. Think about how starting from this framework might change your approach. People with advanced dementia may still experience pride, shame, and embarrassment, have a sense of dignity and self-esteem, feel concern for others, and communicate with some help. So rather than thinking, well, Mr. Jones can't understand this task, I'm not going to really bother talking him through it. We should instead think, Mr. Jones knows when he's being treated with dignity. I'm going to make sure I talk him through every step of this bath and use proper draping and respect his modesty. I love this slide because I really love this sentiment, but also because this happens to be a picture of two people very important to me. My mom is pictured here about 5 years ago, and here she was in the late stages of Alzheimer's and has since passed away. And she's pictured here with her primary caregiver, my father. And when I consider what people in late stages are still capable of, I always think of her in this stage. And I think it's important for all of us to think of a specific person or a loved one that you know and think about what remains for them as we talk through the rest of these slides. Before we dive into specifics, which I promise we're going to do in a minute here, I want to note that ADLs are much more than just tasks to check off our list and complete. They can be activities. It's in their name, activities of daily living, right? So we should be asking, can this activity be an opportunity for connection, for fun, for reminiscence? How can I make this a positive interaction? Getting dressed. Can we enjoy some time together choosing an outfit, stretching as we put on the items, recalling where this outfit has been worn before, matching pieces of clothing? How can we tease out the person's strengths and abilities that remain? In caregiving, we often settle into a position of doing something to someone instead of with them, especially if we're in a hurry, which we often are. I've been there many times myself as a caregiver, but I've found over the years that even if I think I'm saving time by rushing through something, it's often not helpful in the long run. And it can leave a negative impression with the person and make them less likely to want to engage with you. And it often left me feeling more stressed, right? More stressed than when I planned my time a little better and allowed myself to enjoy the task as an activity we were doing together, no matter how much of it the person was able to do. Great, excellent. Okay, so let's jump in here. Oral care, our first ADL. Of course, it's really important. Good oral care can prevent difficulties with eating. The last thing we want are cavities or other dental woes to worry about with dementia, right? We actually have a whole past webinar dedicated to this topic, and I'm sure we'll do it again in the near future. So if you want a deep dive into this, check out our past webinar on this, but I'm just gonna kind of go through some basics here. So there may be several barriers to good oral care. The person may forget how to brush or why it's important, as I mentioned before. They may also have functional limitations, such as changes in their ability to grip a brush, they may have some arthritis happening, or swallowing difficulties, or trouble knowing how to spit. That was always my mom's issue. She wasn't sure quite what to do next. So we might want to look at the equipment we have. Could a softer bristle brush, a more sensitive toothpaste, could that create a better brushing experience? Maybe a thicker handle they can grab a little bit easier, like the one pictured here. That can allow them to participate more than they would. And it doesn't have to be fancy. You can do this with a washcloth wrapped around and tape it. So there's many options here. So how do we best encourage involvement? We might need to try some different strategies based on their current abilities. Maybe they're in a stage where just you brushing your teeth with them side by side might be enough to just kind of cue them into what they should be doing. If they do need hands-on assistance, I love the hand-under-hand technique, which I first saw from Teepa Snow. I'm pretty sure she trademarked that, in fact. This is a really comfortable grip. You're doing the fine motor part of the task, the actual brushing, and the person you're assisting is able to maintain some control. And it feels much more comfortable for them than just a hand with a toothbrush coming at their mouth. You know, picture yourself at the dentist and how uncomfortable that can be. And with this grip, their brain also registers that their own hand is participating in this familiar task. And so they might be kind of more at ease. And then with your other hand, you can try to place a calming hand on their shoulder for some additional sensory input. So it might be a little hard to see in this picture here. I kind of brought a little prop. I don't know if you'll be able to see with my small camera here, but you kind of go in to their hand like for a handshake, and then you kind of slip into this more comfortable grip. And then you can hold the toothbrush. So this would be their hand, this would be your hand, right? And you do the brushing, right? But their hand is here able to give you some feedback. So if there's pain or an uncomfortable area and they kind of resist you a little bit, you can kind of key into that cue a little bit. And this might be much more comfortable for them than just you going, you know, at their mouth with the toothbrush, and they might be kind of more resistant to that. So I'd highly encourage you to look up some videos of that from Teepa Snow. She kind of walks through it better than I can here. And that's a really, really helpful way that you can do that, as well as with eating, which we'll talk about next. So cues. Not all cues are created equal. I want to emphasize what makes a cue a good cue, right? So we want to use simple instruction, one step at a time. And we do need to talk through the steps. Telling a person what you're doing is really important, and it's often overlooked. We just kind of want to get this thing over with, right? Simply saying, okay, let's brush your teeth now. That's not one step, right? That's multiple steps. And we might be shocked at how many steps that is if we wrote them all out. So think about the difference between we're going to brush our teeth now, which is a lot of steps, or let's pick up our toothbrush, right? That's one thing. So acting it out and using the actual object as we talk through the step. Let's pick up our toothbrush. So it's show and tell, and then touch. That's another Teepa Snow-ism that I really like. We want to try to avoid just picking something up and going right into it, right, without talking through it. So show and tell and then touch. Let's pick up our toothbrush and then assist. If you need to repeat yourself, try to repeat yourself in the exact same way so that they don't need to start over trying to understand what you're saying. And make sure they feel heard as well. If they're trying to communicate with you, offer signs that you hear them and validate the emotions behind their words. There's a lot of considerations for anything we do in the bathroom, right? Toileting, brushing, bathing. The bathroom is a tricky place. There's acoustics in there that may be distracting and distressing. Water running can make it really hard to hear and it bounces off the walls. Maybe there's a TV down the hall and that noise is kind of amplified in the bathroom. And these are things that maybe you are able to tune out and you don't even notice. But somebody with diminished capacity may find it harder to tune these things out. It might be the only thing they can think about or focus on, right? So maybe we turn off things in the background that could be stressful. Maybe we have some calming music. Keep it warm, right? The temperature. If you keep it warm in there, it's more likely the person will be more agreeable to the task. And then things like contrast. So perhaps using a colored washcloth in the sink for a target. Think about a white sink and a white countertop. That might be hard for somebody to distinguish as their vision changes with dementia. So I'm offering them somewhere to spit. Monitor for confusion, of course, eliminate potential hazards. Maybe they could mistake a razor for a toothbrush. We want to make sure nothing like that is in sight. Pocketing of food, this is a good time to, check for that. You should be monitoring for that after meals. That might be an indication to you that you need to get a swallow evaluation by a speech language pathologist. So ensuring that you follow up if you notice somebody is picking or pulling or playing with their mouth or teeth. We want to investigate those things for possible pain or other issues. Keep their mouths and lips moist all day. Perhaps an alcohol-free mouthwash or a spray like Biotene or lip moisturizer like the one pictured here, just to kind of help things from drying out. So what if they refuse? Well, let's think about our previous quotes from Dr. Power and try to just simply avoid labeling someone as resistant to care or combative. Let's dig a little deeper. Who's involved? What's happening exactly when this is taking place? What helps and what makes it worse? Think about how many sensory nerves your nose and your mouth area has, right? There's a lot. We do a lot here. We taste, we smell, we talk, we have sensation. It's so sensitive. And so a care task here can be really anxiety inducing. And so we definitely don't want to do battle here, right? If someone's resisting, always consider if pain may be a factor. But you can try different things if you run into challenges. Maybe switch up the location or the time of day, maybe just kind of a quick swish and spit, or those like mouth swabs, those toothets. Keep it fun with some music. And we want to keep offering, but not necessarily to the point of agitation, right? It can be hard work, so try not to get discouraged yourself. We can help ourselves out by making an effort to eliminate a few phrases and words from our vocabulary. Try to eliminate no and you need to do this. We don't love hearing those things, right? So keep in mind that, this person is going to remember how you made them feel. So we want to make an honest effort to not point out what's going wrong or what's wrong with what they're doing. Try to really layer on the compliments and focus on the positive things. If they do perseverate on a certain step, that was always an issue with me. So my mom, if I didn't step in, she would just go on brushing her teeth for like 10 minutes. She just kind of go and go and go. So I'd kind of have to trigger her with what was next, a cue. Here's your cup of water, right? Or there's where you can spit. And kind of mimic that. So, be patient. If someone likes you, if they're having a good time, they're usually willing to do more with you and allow you to do more. So at every chance you get, thank you for working with me. I know this is hard. Thank you for trying. Those things can really go a long, long way. Okay, so meal times is next. And here we see some losses that can typically occur with dementia and how these may impact meal times. So concentration, they may be less able to focus on food and eating. They may be more easily distracted. They may have trouble recognizing food or deciphering what is edible. They may have more difficulty sitting upright or feeding themselves or chewing or swallowing, and their appetite may change. And so we need to pay attention to all these things and figure out solutions to the problem that they are experiencing. We want to help them enjoy mealtime, right? I mean, food represents quality of life. And for many people with dementia, it's something they still enjoy or want to enjoy. And so like our other activities, we want to start with a calm environment and plenty of time. So we're not rushing. Because think about what rushing conveys to the person. Many times it's, I'm too busy for this. And that's probably not the message you want to be sending. Remember what it's like to enjoy a pleasant meal and keep that in the forefront of your mind. As this changed with my mom, who I cared for, what used to take maybe 20 minutes started to take upwards of an hour. And at first I'd get really frustrated because I wasn't factoring that into our day, right? And I'd still try to get it done in 20 minutes and I'd try to rush her. And of course that backfired, right? But once I accepted that it was gonna take longer, I kind of settled in for it. I planned our day around it. It was much less stressful. I saw it as a time for us to connect. And so if you're able to do that, kind of factor that in, try to plan for that a little bit more. Let's think about person-centered details. The more we have, the better. How did they like to eat in the past? Are there any rituals or routines we can still help them with? Can they still eat foods they used to enjoy? Or if not, how can we adapt them to their current level of ability? Do we need special equipment, like things pictured here, weighted silverware, better grips? This bowl with a lip is really cool. It can help keep things on their fork or spoon as they grab the items rather than just plopping over the side of the plate. And there's tons of stuff like this, and a great occupational therapist can prescribe or recommend other equipment. Surely we've all been taught the importance of a first impression. The initial approach can set the tone for the whole interaction. Now, we often teach an approach from the Best Friends Playbook, which teaches you that you invite the person to do an activity as you would a friend. So instead of, you need to eat now, oh man, that smells good in the kitchen. Would you want to come with me and see what's for lunch? I mean, how much more inviting is that, right? It's an invitation, it's not a command. And it doesn't need to look exactly like that, but you can see the difference in the emotion between the two, right? One feels very forced, and one feels like something I might actually want to participate in. Other communication tools you've likely heard before: approaching from the front, smiling, making eye contact, introducing yourself, avoiding a confrontational, towering over them stance. Crouch and lower yourself. Pay attention to your tone and your body language and theirs. Are they backing away? Do they need more space from you? How can we accommodate that, right? The first key to engagement is to be present. So try to have everything you need so you can avoid getting up and going and getting things during the meal, because this can be really distracting and probably make them want to get up with you too. They see you getting up, they think, oh, it's time to get up. And so if you're kind of rushing around and trying to do other things, that can be really distracting as well. If they need more assistance than you just eating side by side and cueing them, that hand-under-hand technique we discussed earlier works really well here as well. A lot of times when we teach this in groups, in person, we actually do an activity where we feed each other. And if you've never done this, I highly recommend it because it's pretty eye-opening. And it takes practice to get good at helping someone else eat. So that hand-under-hand technique with both hands, practice with your right and your left, because you want to assist them with their dominant hand that they're used to eating with, right? So that their brain kind of triggers that it's them partially doing the task. Other ways to maximize a person's involvement, aside from the other adaptive equipment we talked about, making sure they have their own adaptive equipment, if that's eyeglasses or hearing aids, so they can fully enjoy conversation and hear what you're talking about. And this will also help them be as independent as possible, which is what we want. Of course, talking through the steps in a clear, calm voice. If you're giving them bites, pay attention to when they swallow before you're offering the next bite. Try not to be distracted on your phone. Gentle touch can encourage them to kind of stay present with you or more focused if they become distracted or unsettled. Think about routines and preferences. Do they like to get dressed nicely for dinner? Was she the cook? Was he typically the last to sit down? Any rituals or customs we can try to continue if they still hold meaning for the person? If they don't hold meaning anymore, then is there something new we can try? Try to eat in the dining room or where meals are typically eaten. That can really help keep the focus on the food and avoid distractions. If the person sits in a wheelchair normally, can they be transferred to a dining room chair with a nice, firm, straight back that lets them have a normal and more safer posture at meals versus like reclining back in a bed? I love the idea of keeping meals special. Most of us love mealtime. I look forward to a nice dinner. If there's a walk to the dining room, that can be part of the experience too, right? Saying something like, hey, Susan, dinner's being served. Are you ready to eat? Or, hey, Mr. Jones, you have a table reserved in the dining room. That can make someone feel really special. And of course, these are much preferred alternatives to you need to eat now, right? Anything we can do to liven up the meal, whether it's a mocktail or a nice looking tablescape or colorful plates, I'm sure many of you have heard of the study with that red plates were shown to increase how much a person ate at mealtime with dementia. That color contrast can be really helpful. So there's tons of stuff you can do here to make things fun. If they're not interested in normal meal times, try to make good quality foods available around the clock. Shakes or smoothies can be an easy way to get some calories in. As their appetite changes and smell and taste is more diminished, it's important to focus on what they enjoy here. Think about quality of life, right? If this is me, give me all the Girl Scout cookies that I just got delivered, right? Don't worry about making every meal super nutritious necessarily. Finger foods can be anything we can cut up into manageable pieces, right? We can kind of think outside the box. I'm a couple months into the solid foods journey with my new 8-month-old son, and we've been doing some fritters with veggies and eggs and all kinds of things, and then we just kind of cut them up into strips and he can eat them himself. So these things can work really well for lots of people. Finally, there's a higher risk for people with dementia to experience dehydration for a number of reasons. Decreased thirst sensation, dependence on others to get them drinks, swallowing difficulties. If there are concerns about swallowing, again, please consult a speech-language pathologist. They may recommend thickening liquids for the person. And as long as it's safe for them, we may be able to entice hydration with fun additions to the glass, such as color or berries. And we can utilize foods that have higher water content, like cucumbers, tomatoes, watermelon, or soups. Just kind of be mindful of that salt content. So get creative here. Toileting. So getting into more of the bathroom activities here. So while we may not be able to do a full bathroom remodel, there are a lot of ways we can modify a bathroom to adapt it to some of the common challenges we see with toileting and also with bathing. So raising the height of the toilet seat, that might be really helpful because getting up from a low surface can become more difficult with age. Again, that color contrast, I talked about it with the sink, but with the toilet as well. It can be difficult to differentiate between a white toilet and a white ground. So maybe they're not perceiving where the target is, right? So if we have some contrasting toilet seats, that may stand out to help maximize their autonomy in the bathroom, right? Of course, we want to evaluate any rugs or mats we have for fall risk and any areas where water might pool up, right? Slippery surfaces. Grab bars are always a great idea. There's tons of flavors of these. There's ones that fold up and down, attached to the wall. You see some that go right over the toilet seat here, toilet. Don't hold onto the towel rack, whatever you do. Install those grab bars properly. And then my favorite, the bidet. This is one of the best changes we made to our bathroom, and it helped a great deal with hygiene when we were taking care of my mom. I've noticed they're becoming more popular in the US. They're more mainstream, I think, in places like Europe and Japan, but I see more and more commercials for them, and I'd highly recommend it. It's actually a great addition. It can help a lot with hygiene. Incontinence is unfortunately part of the progression of Alzheimer's disease, but if it's a new onset thing, it's a good idea to have a medical professional rule out any other issues that may be happening, like a UTI or a fecal impaction. A person may no longer be able to communicate to us when they need to use the toilet. So we need to be observant and we need to notice when they're giving us signs about needing to use the toilet. Maybe it looks like agitation or fidgeting or tugging on their clothing or wandering, looking for the bathroom, right? There's usually a reason they're wandering around. So a way to address this is to take the person to the bathroom on a regular schedule. Most professionals recommend every 2 hours. I'm also going to plug our webinar for next month here, which is on the topic of incontinence, and I'm sure we'll do a much deeper and better dive into this topic. I'm excited for it. I hope you can join us for that. How do we maximize their autonomy? For one thing, let's not rush them. It's stressful. If you are not a fan of being rushed to do something, especially in the bathroom, then they probably aren't either, right? So just try to maintain a calm environment. Assist them with clothing as needed. Consider maybe if you could use some pants that are easier to remove or don't require a belt, that could be helpful. Maybe you're handing them toilet paper as appropriate or wipes. You might need to help them get started, tell them what you're going to do or what step is next. Again, bidets can be really, really helpful here. Maximize their autonomy wherever we can. Easy things like putting up a sign. Maybe it's a picture or maybe it's words on the door to the bathroom. Maybe leaving the bathroom door open so they see there's a bathroom in there. Maybe that can help prevent some accidents and help them, again, have a little more feel like they have a little more autonomy than just having to depend on you for everything. Lastly, some tips for nighttime. So consider the use of a bedside commode if nighttime is a big issue and it's recurring. Or for men, they have bedside urinals that you can use. Consider using night lights, maybe some motion activated ones. So if a person is walking to the bathroom at night, it's not a fall risk. Making sure they're staying hydrated throughout the day, but perhaps limiting fluid as it gets closer to nighttime can be helpful as well. And pads or diapers, they're likely going to become necessary at some point, right? But it can, of course, become an issue of dignity for someone. I would consider referring to diapers or pads as underwear, adult underwear, rather than just calling them diapers, because words matter, appearance matters, right? I've heard people tell me they replace the underwear in the person's drawer with the diapers. That kind of normalized them a bit more, right? They're in your dresser drawer. We're not like grabbing them from under the sink or some random bag. And that can help the person become more agreeable to wearing them. I think it's a great idea. The big one, bathing. Bathing is intimate, right? It's a task we often struggle with the most. And research has shown that among all ADLs, bathing impairment may have the highest future risk of institutionalization. It requires a lot of advanced planning and time. And forget if it was Teepa Snow or Dr. Al Power who said, being in somebody else's personal space either requires an invitation or an explanation. So keep that in mind. I think we get into some hot water, so to speak, when we go guns blazing. Like we're like, okay, bath time, got to suit up, going into battle, no time for explanations, got to get through this as quickly as possible because we both hate it and it's going to be the best way forward for everyone, right? But this can and often does backfire. Bathing difficulties can be driven by many things. Our approach as caregivers, the environment, the needs of the person receiving care. When I discuss this topic with groups, I often ask the participants, imagine how you would feel if someone came into your house tomorrow and just said, hello, I'm here to give you a bath this morning, and then just proceeded to undress you, right? How would you feel? How would you react? You'd be like, no, you're not. Who are you? One of the best resources I've discovered on this topic is a training video called Bathing Without a Bottle. And it's developed by a number of care providers and clinicians from a couple different universities. And I just looked for it this morning. Unfortunately, it used to be free, but I think they might have a charge for it now. But if it is, I mean, if this is an issue for you, I'd say it's money well spent for sure. A lot of things I'm going to be talking about are taken from it today. And it teaches care providers to recognize and respond to signs of discomfort or distress and implement strategies for reducing that distress. And they did lots of studies on their techniques, and they found that it resulted in fewer behavior expressions like yelling, and it also ended up shortening bath times, right? They show some videos of like before they implemented these gentle techniques and then after, and the before videos are actually pretty distressing, and then they show you the after videos and you're kind of like relieved. But just keep that in mind if you do watch that training video. They have some videos in there that can be a little bit distressing. So the woman who kind of spearheaded Bathing Without a Bottle, her name's Joanne Rader. And she decided that before she developed this intervention, she needed to really experience what it would be like to have others bathe her. She had to get the full experience. So she had her colleagues undress her fully and bathe her, just like they did with their patients and residents. And she volunteered for this, right? She knew exactly what was happening, but she still reported feeling embarrassed through the whole experience. She commented that things that typically felt pleasurable for her during a shower, like having water run over her head and her face, now felt torturous when they were out of her control. Think about what else a person with cognitive changes may be feeling. Lack of control, confusion, cold is a big one that can be overlooked and often easily addressed. They may be anxious or unsure of how to plan and execute the tasks. And as I mentioned before, the acoustics in the bathroom can make for some really distracting sounds, and they may be fearful. In Bathing Without a Bottle, they listed out some of the most frequent causes, things that happened right before they saw a behavior or behavior expression during personal care. And it was things like touch or invasion of the person's personal space, a tense caregiver, a task-oriented rather than person-oriented behavior. So let's talk through how we can address some of these challenges. Dignity is huge, right? Remember back to one of the beginning slides, what is preserved in the late stages of dementia, the ability to experience dignity, right? So we want to use draping. It's a simple thing, but it's something that took me a long time to realize it would be so helpful. Most people will likely want to be covered up while other areas are being washed, and this also helps keep them warm. Now, you can get some fancy garments that I'll show you in a couple of slides, but you can really just use some towels. You can wet the person through the towels, you can wash underneath them. If the person is hesitant to undress, you can try to get them down to their undergarments and then wrap them in the warm towels and then wet them through the towels. And they're likely not going to want to stay in wet undergarments for very long, especially when they're covered up, right? Staffing, keeping the same staff whenever possible. We may think they don't remember changes in people, but limiting changes in staff or caregiver has been one of the things shown to have a real impact on decreasing distress. And I know a lot of times this is out of our control, but as much as we can, we need to keep that in mind. This brings to mind another story I think about with bathing, a physician named Dr. Emmy Kyoto, who wanted to experience what it was like for residents in her nursing home. And so she slept there for a number of weeks as a patient, as a resident. And she had her staff bathe her. And they actually gave her bed baths, so it was slightly less invasive. But she is still quoted as saying, "By the time the third stranger in a row came in to remove my clothing and bathe me, I thought to myself, I have no dignity left." And that line always sticks with me. And this is a person who signed up for this, right? So they know what's going on. But what about those we care for who aren't as aware? How are we helping to put them at ease? So limiting helpers to essential people, right? This is not a time for a bathroom party. Bathing should be a one-on-one activity whenever possible. More feels like a battle, right? And it may end up causing more distress. Finally, and maybe most importantly here, using kind language, timely warnings, and asking permission. So what do I mean by this? Because of the brain changes the person's experiencing, they're no longer processing information the same way. And that fight or flight response may be a little more easily triggered. So there was a study by a woman named Karen Tallarico, and she highlighted the importance of timely warnings. And these took place before providing care, that's the timely part, rather than after, which is more typically done, right? These warnings were especially important before potentially painful or uncomfortable caregiving events. So an example might be, we're gonna get cleaned up. I need to uncover you for a minute. Is that okay? I'm gonna do my best to keep you warm. So this was a timely warning and then asking for permission. And that was kind of the secret sauce they found that helped prevent both verbal and physical expressions of distress, or behaviors as we call them. And it seems kind of simple on the surface, but it was actually really difficult for the staff in this study to make the change at first, because we're very ingrained in our ways of doing things, right? How can we best engage the person? When are they at their best? Maybe not at 5 in the morning, right? This is different for everyone, but we do want to bathe them when they're at their best. Focus on the person. Be gentle. Think about patting instead of scrubbing and rubbing. What would be uncomfortable if it was out of your control, if somebody else was doing it to you? Rushing conveys anxiety. Something as simple as holding their hand and using some light pressure can be really calming, as well as small talk. Help them feel in control by encouraging them to do what they can. Maybe it's washing their face, or maybe it's just holding a washcloth. Whatever it is, try to meet them there. What can we do to make it as comfortable as possible? As I mentioned, it should be very warm. This is one of the big things, right? Again, Tifa Snow says, if they're gonna be unclothed and warm, and you're clothed, you should be sweating. So think about how warm that needs to be. Think about a spa type of environment, how calming that is. Perhaps light music, nice scents, a candle if it's safe. And then the water flow. If we can use a handheld shower head to kind of reduce the water flow, make it a little less overwhelming, and control that temperature really nicely. Safety starts with preparing everything you need in advance so you don't have to leave the person to get anything. Similar things to what we talked about with toileting, non-slip mats, grab bars, shower chairs. There's so many kinds of these, one to fit every possible situation. And when they're safer, you're both going to be more comfortable, right? Of course, always looking out for hazards like a hair dryer next to a bathtub, things like that. Daily bathing may not be in the cards, but we can still maintain good hygiene. And sometimes simplifying the routine is helpful, right? When bathing my own mom became challenging, we decided to split it up. We did her hair one day, we did bath on another day, and this cut down on a lot of discomfort. We didn't have to rush through as much. So think about how you frame something too. My mom was rarely agreeable to bathing. If I was like, we're gonna go take a bath, she's like, no. But if I framed it as us doing her hair really nicely, she would rarely refuse because she loved the way her hair looked when it was curled really nicely and blow dried. So I grew to really love that special time with her. And at one point I thought that would be impossible. And they basically walk you through how to do this in their presentation. I'm sure there's other YouTube videos as well, but basically you kind of take a large bag, you put a large thin towel or a bath blanket and some smaller towels and washcloths in there. And then you have this no rinse solution that you mix with the appropriate amount of warm water, and you kind of work it through the bag. And then essentially the person is literally in their bed, right? And you go and you kind of work the large towel or the bath blanket under the person's regular blankets. And so they're warm, they're covered up, and then you kind of use that big towel like a big old washcloth, and you gently wash them and explain to them what you're doing, roll them to the side to get their backside. And the best part is there's no rinsing or drying required, right? Everything's kind of taken care of. They have lots of tools that you can use for this. So if you want a detailed look at this, bathing without a battle, but again, it can get a person just as clean and it can cause a whole lot less distress, right? They also had other examples, like a person was standing and wearing a loose gown, and they kind of did it that way instead of in bed, but they were just fully covered up. So there's so many things that we can do to think outside the box here. It does not have to be a battle. These are some of the fancy bathing garments I mentioned earlier, very fashionable. But again, a towel works just as well. There's all kinds of stuff out there. There's this inflatable bed I've never used, but if you use that, let me know how it goes. Very interested in that one. So let's move along here. We got two more. Grooming. If a person is going to a barber or hairstylist, or maybe they're coming to the house or care facility, let's continue that as long as possible, right? That's probably a treat for them. At some point, we're going to want to help simplify their routine with safer tools like razors, being mindful of that. How can we make it comfortable? For men, there was a study that showed that shaving could be very painful, but if their face was warmed beforehand with a hot, moist towel prior to shaving, this really helped a lot with discomfort. Detangling products are helpful when combing hair. Maybe you spray it on the brush instead of their head because it might be cold on their head. So all these little things we need to think about that will really make a difference in the routine. Using their favorite products, performing things alongside them, lots and lots of compliments. This is the perfect place for lots of compliments. They're getting all gussied up, right? We feel better when we look our best, and it's really nice to hear somebody else tell us that. So we made it, the final task, dressing. It can be overwhelming. It can be overwhelming for me some mornings, especially after a couple of years of a pandemic where I've been wearing sweats every day, right? Add cognitive changes to the mix, and it can be really challenging. They're going to need some extra time. They may have a desire to wear the same clothing over and over again. That's common. My mom had a dog sweater phase that was very serious. And so we bought a couple of those. She could wear one while we washed the others. And eventually, as most phases with dementia do, it passed after a while, right? So how do we help them be as independent as possible or as long as possible? For one thing, with a lot of options in the closet, choosing what to wear can be really difficult. So we want to simplify that. Maybe we just have clothes for the season in there so that it's a lot easier to give some choices. We choose simple, comfortable clothing. There's tons of adaptive clothing out there today that's very nice and stylish. The person may have a desire to remove clothing at inopportune times. So they make these clothes that are kind of more difficult to get off, like zippers in the back. But we always want to think about why they're doing that, right? Why would they want to undress? And most likely it's because they're hot or uncomfortable and they just can't tell us. So we want to make sure we're not adding to the problem with clothing that's tricky to get off. Slip-on shoes, labeling drawers with words or pictures of items of clothing just to help them maintain that independence for as long as possible. Instead of just doing the task for them, laying out clothes in the order they can put them on, helping them out. And while you're laying out the clothes, laying on the compliments and the smiles too, right? This does help a lot. If you're met with some resistance, consider if pain might be a factor. Things can get challenging as we age, so maybe some gentle range of motion before we put the arms and legs through can loosen things up. Couple final slides here to tie everything together. Everything we discussed today comes down to communication. Our loved ones and our clients want to feel heard, understood, and validated. So if what they're trying to communicate is unclear, offer a guess. Calmly, briefly respond to the emotions behind the statement and use appropriate touch as you assist. But remember that entering their personal space requires an invitation or an explanation. Battling never ends well. We just want to avoid correcting or arguing where we can. If we can walk away and hit the reset, that's a much better alternative. Can we look beyond the present challenge to enhance well-being for the person in front of us? How can we change their day to allow for more choice, more security and safety, more connection? Are we only approaching them when we need something from them? How is that going to make them feel every time we go up to them, right? Or can we find little ways to connect with them when we don't need something from them? That could make a big difference. We might be helping more than is necessary, especially if we're rushing. And so this is going to lead to a lot of stress, right? And it might rob the person of some ability to do things for themselves, which can definitely lessen agitation and discomfort. Do we know what matters, and how can we honor that? Remember, these are activities. They can be so much more than just tasks and even enjoyable. I used to think the faster I get this done, the sooner it'll be over, we can move on to something more enjoyable. But then when I started to treat these as part of our time together and allowed myself more time to complete them, it became much more enjoyable. Keep a routine, but if something's not working, don't be afraid to switch it up. So I hope that some of these things we talked about today are going to help you do that with your patients, your clients, your loved ones. And thank you for bearing with me as I talked a little bit quickly through this. And hopefully we'll have time for a few questions here. I'm going to turn it back over to Kim.
Wow, Melissa, that was absolutely fantastic. And we do have a lot of questions. So let me just say that use this time, everyone, to, if you haven't already done so, go ahead and type your questions into the question box. We'll get to as many of them as we can, but we are running over a little bit, which is fine. Melissa is going to stay with us. And so just wanting you to know that you can leave if you need to, but we would love it if everyone stays. If you're earning CE credit, just make sure you've been on for 60 minutes before you leave us. I also just want to take a moment to thank all of our sponsors again. They make these fabulous presentations available for free for us. So we owe them a debt of gratitude. Thank you, O'Connor Mortuary, Care Choices, Hospice and Palliative Services, Comparing Companions at Home, and Alzheimer's Orange County. All right. So, and one other thing I want to mention before we do our questions is that next month's webinar, Melissa alluded to that, it is on incontinence, and that has been a very, that's been a topic that's been in demand for a while. So we're excited to bring that topic to you on March the 8th, and our speaker will be Donna Thompson. She's a certified family nurse practitioner. So everybody make sure you save that date. And with that, I'm going to go ahead and open up our question box and see what we have. And oh boy, we have more than a few here. So let me see if I can group some of them. Would an electric, this is a oral care question, electric toothbrush helpful or not helpful, Melissa?
I mean, I think it really depends on the person. We used one with my mom for quite some time. She was used to that from before though, so if that's like a new thing that they haven't been using before, maybe that might present more of a challenge. So I'd say there's probably no harm in trying it. And if, you're met with kind of more resistance than usual, or it's kind of overwhelming for them, maybe you opt for, a non-electric one. I don't know, Kim, do you have any thoughts on that as well?
I agree. If they're accustomed to it, it's fine. If they're not, then they're going to probably be resistant to something buzzing around their face that is new to them. So yeah, I agree with you, Melissa.
Definitely.
Let's see. Oh, someone wants to know the name of the video again. Was that Battle of the Bath or?
Oh my goodness, no. Bathing Without a Battle. I like that title.
I was close.
Battle of the Bath. So it's called Bathing Without a Battle. It's done by a couple different, I think there was a university in Oregon and then a University of North Carolina, I believe. And again, it used to be free, and it like they offered CEs for nurses too. And I was just looking for it this morning, and all I could find was a DVD that cost like $60, which may sound like a lot, but it's chock full of really great things. So if this is something like if you have staff at a care facility or even just as a personal caregiver, I found it immensely helpful. So I mean, I think it would be money well spent. But you may be able to find like some clips and stuff. I think there's also a hard copy, like a book. So again, Bathing Without a Battle, very, very good resource.
Yeah, great. And someone's asking for a link to that. So Michelle, I think you found a link. Would you mind putting that in the chat? Or you can do it, Melissa. Everybody's really super interested in that.
I can see if I can pull it up here. If you just Google Bathing Without a Battle, it comes up, but
you know what? I found a link. I found a link to it on Amazon to the book.
Okay, yeah, that's probably the book.
I did paste that in, but I don't know if people can actually click on it from the chat. So
okay, well just go to Amazon.
Yeah,
and that should work.
Yeah,
I just sent a link as well to the DVD.
Oh, thank you, Melissa, and thank you, Michelle. Could you please repeat the name of the book and the author? So I think they're talking about Dr. Power. Yeah.
How convenient. I have it right here. I reference this book so often in everything I do in presentations. This is called Dementia Beyond Disease by Dr. Al Power. He also has a book he wrote before this called Dementia Beyond Drugs. I think whether you're a personal caregiver, whether you're a professional, I think those are two of the best books I've ever read on dementia care, just his philosophy as well as practical tips. So if you're looking for something to read, I highly recommend it.
Okay, good. Thank you. This next one is from one of our professionals. She works, she has 12 residents to get up. She starts at 5 a.m. and she's got to clock out at 7 a.m., no overtime. I have a difficult time because all of my residents need prompting for everything, brushing teeth, telling all the different steps. She usually picks out a couple of outfits like in the middle of the night and lays them out, so they'll have those. She sounds so wonderful. She has those to choose from. Each step needs to be explained with dressing and using the toilet, hygiene, all of that. And so I don't know what the question is, but I want to give her an award. And I know, like so many of our professional, they're in the same boat. And so it's obviously different when you're caring for one person. When you're a staff person, you have a whole bunch of residents to take care of, then it is different. It definitely is. So what can she do? She just wants to do everything for them.
It's so difficult. And
suggestions.
So this person, you're doing it. You're attending education. You're trying to get all the tips and tools you can use. You're not Superwoman as much as it sounds like you are. There's just, you're gonna have those, unfortunately, some of those institutional things that you cannot control. But knowing as much as you can about each of your residents and just incorporating those little things, and talking to the rest of the staff as well, other people that care for them, sharing ideas. I hope you don't feel too alone in this. I can only imagine how overwhelming that is. So I hope there were some little things that you're able to pick out today, but obviously, you have a lot that you're dealing with. So there's no magic formula, unfortunately. It's kind of all person-centered stuff that we're talking about here.
Mm-hmm. Absolutely. Yeah, and let's just take a minute to recognize all of our great professionals online with us today who are out there doing an incredible job for people living with dementia in those settings. And we know how much we appreciate you. Let's see, I guess a large bed sheet might cover a person better while still letting soap and water through. Will that work, Melissa? And as opposed to,
give it a
I
try.
think you suggested a towel.
Okay. Yeah, I think they make like these bathing blankets or a large, thin, kind of anything you can kind of lather up, right, with that no rinse stuff. I mean, try what you got. I don't see any harm in trying it.
Yep. Next question is, how do you deal with an adamant no?
Oof. Oh gosh, that's so tricky. I think with everything, and if you caught the webinar last month with Kim, we talked more specifically about behavior expressions. That idea model comes to mind. you know, is it a no all the time? Are there some times during the day that the person may be a little bit more agreeable? What exactly is happening? You know, being a detective, taking kind of detailed notes on what exactly is happening. Is it always happening with one person? Does it happen with everybody? You know, it really comes down to person-centered stuff, and how can we make this as comfortable as possible? And how does the rest of their day look? You know, are they content the rest of the day? Is this the only time that they're kind of upset, or are they needing kind of more things throughout the day? Are they needing more opportunities for connection? Do they feel safe and secure? Do they feel loved? You know, just the makeup of a person's day. You know, if they're having a bad day and that's kind of the last straw always, that can be really difficult. But if we can kind of do more throughout their day to give them more autonomy, more control, can we get to the bottom of the no? What exactly is it about this task? Is it just that they kind of have had bad experiences that we can reframe? How can we make it fresh? You know, there's so many things, and it's really hard. It's hard when you just have the no and you want to just in that moment solve it. But I think it just requires a little bit of pre-planning and a little bit of detective work. Kim, what would you say there? I hope that was helpful.
All of that is so helpful, but I'll just add that in the end, no means no. And you know, we always say this, if you
Yes.
don't insist, they can't resist. And so just withdrawing the command, you know, whatever it is, and maybe trying again later, you know, it's certainly doing all of that detective work that Melissa was talking about, but recognizing that, you know, if you get into an argument with them, you're not going to win, and everybody's going to be upset. So we can always delay tasks. I think we worry a little bit too much about like checking things off our list, as Melissa said earlier. People do not need to be bathed every day, for example. And so if they just adamantly say no one day, we can try again later, or we can try the next day, or we can get a colleague to try. Sometimes a change of face will help with those sorts of things. So
yeah. And something else that comes to mind that I don't think I mentioned during this webinar yet, but something that helps personally with my mom, and I've heard others as well, is instead of being like, okay, you know, we're going to get cleaned up now, asking her to help me. Can you help me in the bathroom with something? Can you help me, you know, wash my hair, and then, you know, we'll do yours. So she was rarely disagreeable to helping me do something. And maybe that was just little steps like getting into the bathroom, and then we kind of figure it out from there. But kind of reframing, I think, can help as well. Thinking about what motivates that person.
I love that. That's great. A little trickery sometimes can work, right? Yeah.
Sure.
My mom is 85 and takes over 45 minutes to shower. What can I do to gently remind her to wrap it up without making her feel bad?
I guess I would ask, is it like a water issue? Is it important that we wrap it up quickly? I would have been stoked if my mom was just like chilling in the shower, but I know that maybe, you know, you got things to do. And so maybe it's just kind of cueing the next step. You know, I have a nice warm towel for you here. We have a treat out here, whatever kind of, again, what motivates her? What does she want to do next? You know, is there an activity, or is there a food or something that, you know, we can kind of encourage, you know, hey, this is happening next. Maybe she's just kind of zoned out, content in there, and no plans to end it anytime soon. Yeah,
agree. Yeah. Was it difficult for your mom to transition to the bidet, to using the bidet?
That's a great question. I think she kind of just was sitting there and it didn't almost like register that it was like this new thing happening at a certain point. I think we kind of did it almost like we should have done it earlier probably, and that might have caused a little more confusion on the one hand, but then made things easier for us as well. But it was kind of in a stage where she wasn't as aware, so it was kind of just, you know, oh, there's a new thing happening, and that's fine. And it was comfortable enough where she didn't, you know, there wasn't like a fuss or anything like that. But definitely super helpful. If that's possible for you, I'd highly recommend it.
Oh, there's so many questions. I just want to insert a caveat here. We, through our helpline, have fact sheets available on each individual activity of daily living that you can request from our helpline. You can also pull them off of our website. So keep those things in mind, because we may not be able to get to all of the questions. Also, some of your questions about ADLs could really be, you could be well served by calling our helpline, and they could give you information just as Melissa is doing so today. Just a couple more. Is it helpful to hang photos of the patient, or does it cause her more confusion every day? Because every day we need to remind her who she is.
That's an interesting question.
That is, yeah.
I would just focus on the person's reaction. Is it distressing to them to have photo? Are they like, that's not, you know, like I remember showing my mom a photo once of her, you know, young. She would always look at younger photos of herself and really like she loved looking at them, but then she would kind of look at herself in the mirror and she would get a little bit sad sometimes. So we kind of covered up the mirrors. I mean, it just that was just how she reacted. So I think you have to look at the person's reaction. Are they happy to reminisce and look at those photos, or are they distressed? And if they're distressed, there's not really a point in my mind of keep continuing to remind them about something. Maybe you hang photos of their family or of other things that bring them joy, beautiful locations or other things that you can talk about. I don't see a need in continuing to remind someone about something that's distressing to them. So yeah, that's good. I guess, Kim, I don't know if you have anything else.
No, and I'm not sure. I think maybe she was talking about photos of family members, as you just alluded to. Maybe that's what she really meant here, to remind her of who her family members were. So is that something you think is a good idea, to have photos of the family around?
If it's calming, if they enjoy it, yes. If it's distressing, I would say no.
All right.
I would do.
Is hearing often affected with Alzheimer's or audio processing? Great question. Yeah.
I know that hearing can be correlated with an onset of dementia or other cognitive difficulties. And we do know that just sensory processing in general becomes more difficult. You know, vision, as a person progresses in Alzheimer's, you know, we have peripheral vision, but it kind of becomes this like tunnel vision. We're very focused on what's in front of us, as well as with, you know, auditory things. It's harder to kind of tune out distractions, so we can be kind of more easily overwhelmed. I don't know specifically about, I don't want to like dive into, you know, audiologist territory here. We do have another webinar on hearing and cognitive decline that I think would be very interesting for you if you're interested in that. But we do know that sensory processing in general just is affected by the brain changes of Alzheimer's.
Yeah, speaking of other webinars, don't forget everyone, we have a growing library of videos on our website. So please visit our website. You can click on education and it'll pull up all those great past webinars, and some of the topics that we've been talking about today, they drill down into a little bit more detail. I think we are almost finished. I just want to mention one thing. This was just extraordinary, and I know it's going to be so helpful to so many. I wanted to mention too that let's not forget about the cultural considerations of the folks that we're caring for, especially since we do have a large number of professionals on the line. Keeping in mind, you know, their preferences. I know I was thinking about this when we were doing the part on meal times. You know, a lot of times people are rejecting food because it's not food they're used to, or that, you know, that's ethnically appropriate for them. So, and just some of the cultural norms around privacy and things like that. These are just a couple thoughts that I had before we end for the day. But I want to again thank you, Melissa, so much, because this was just absolutely great. And
Thanks,
again, yeah, I learned something new on all of our webinars, but I think this is one that's really going to help a lot of people. So again, don't forget about our next webinar on incontinence. That's coming up on March 8th. Thank you again to the sponsors you see on our screen. And as I close the webinar, I wish all of you good day, and don't forget to watch for the survey that's going to pop up on your screen. And take care, and we'll see you next time.
Thanks, everyone. Thanks, Kim.
Thanks again, Melissa.